Welcome back. This is Susan Nienhaus with Allied Health Career Training. Today we're going to talk about Unit 5, meeting the residents' need for infection and prevention control. We're going to learn the reasons why infection prevention and control is important. Microorganisms are presented everywhere in the environment. Think of all the things that you touch on a day-to-day basis. Light switches, door handles, shaking hands with somebody, passing papers from one person to another, the copy machine, the buttons, the elevator buttons. All of these have microorganisms on there. Some of these microorganisms are called pathogens or diseases. Some of these pathogens have developed resistance to antibiotics, making them hard to control. Elderly people and persons with chronic disease often have immune systems that are not active, and they are more susceptible to pathogens. A good example of that is, think of having these Pac-Man inside of our body. I'm sure everybody's played the Pac-Man game and how it goes around eating everything up. Well, think of having Pac-Man inside you, and then a microorganism invades your body. Now all these Pac-Man are going to race to it and try to eat it up. It's going to try to keep us from getting an infection. Now we're going to talk about infection prevention and control. We need to be careful and not prevent cross-infection. What do I mean by preventing cross-infection? Well, that's protecting the residents, the visitors, and staff from acquiring an infection. Say we got the flu going around. Well, we don't want to pass it from one person to another. We also don't want the staff to carry the infection home to their family members. Nobody wants to take that home, of course. We don't want our children to get sick from things that are within the facilities or the hospitals. Nosocomial infection is a term that's used for an infection that's acquired within a facility. It also could be acquired within a hospital. It's called healthcare acquired infection. We also need to prevent reinfection. Protect residents who have been infected from being infected again. Be very careful if you have a resident that's been sick with maybe the flu. Now you have a resident on the other hall that has the flu. When we're going from one room to another, we must wash our hands, take good precaution, because we certainly don't want to take it back to somebody who's just now getting over it. We must provide a safe environment, as free from pathogens as possible. We also must reduce the number of pathogens and hinder their transfer to decrease the opportunity for the spread of infection. Medical abscesses is another term that we will use in the healthcare setting. Now we're going to talk about the nature of microorganisms. Some of the names of the most common organisms that can be pathogens include bacteria, virus, fungi, and parasites. Now, these common organisms have to have certain things in order for them to grow. For instance, they need food. Most microorganisms need organic material for nourishment. They also need moisture and light. Most microorganisms grow well in moist locations and in darkness. They also need oxygen. Most microorganisms, particularly bacteria, need oxygen in order to live. Temperature. Most pathogens thrive at body temperature. We are the perfect host. They love our body. And that's why we have to always observe what's going on at the surface of the skin. So these are some of the common organisms and the conditions that affect their growth. Now, let's talk about modes of transmission. How are these pathogens transmitted? Well, the first one we're going to talk about is direct contact. Direct contact is touching the source of infection, then touching a susceptible body location. For example, touching secretions or feces from a resident, and then touching a break in the skin or even mucous membranes. Hands can transmit infection by direct contact. All right, indirect contact is another way. Here's an example. Well, first of all, infection is picked up on an object and then carried to a person. That's indirect contact. A resident's feces contaminates the floor, and the visible residue is cleaned up. And then a drinking straw falls on the floor and it's picked up for another resident to use. That would be indirect contact. Droplet spread. These are pathogens that are transmitted by droplets, given off by coughing, sneezing, and talking. I hope everybody knew when we're talking, moisture just comes right out of our mouth. And when we sneeze and cough, and that's droplet spread. Now, don't get droplet spread confused with airborne spread, because airborne spread is pathogens that are spread with small particles like dust. Have you ever hit your couch and then looked in the air and you see all these things floating around? There's your dust particles. Another way is through vehicle spread. This is pathogens that are carried by contaminated food, water, and blood. Blood-borne pathogens. So these are some of the ways that pathogens are spread. Direct contact, indirect contact, droplet spread, airborne spread, and vehicle spread. Now we're going to talk about some terms. Clean. Clean is clean. You know, we mop our floor, we wipe off our counters, we try to get them as clean as possible. You're going to hear the words contaminated or even dirty or soiled. I think that's pretty self-explanatory. And then you're going to hear the word sterile. Now, we're also going to talk about terms that are describing the process of removing these microorganisms. This would be disinfectant, sprays. We spray different, like Lysol. We spray those on different things to try to get as many of the microorganisms off as possible. We can't completely take them all away, but maybe we can get as many of them as we can. Sterile, well, the only way that we can make something sterile is to heat it at a very high temperature. In surgery, they use what's called an autoclave, and that's how they make the instruments that they use for surgeries sterile. They put it in an autoclave and it's heated up to a very high temperature, and all the microorganisms are destroyed. So these are some of the infection control terminology that you're going to hear from time to time. Now we're going to talk about some systems of precaution used for infection control. The Center for Disease Control, the CDC, has outlined 2 systems of practice for limiting the spread of blood-borne pathogens and other pathogens: standard precaution and transmitted-based precaution. We're first going to talk about standard precaution. These are infection control practices that are to be used for all care on residents, whether they are or have been diagnosed with an infection disease or not. If you really want to keep yourself safe, you should treat everybody as if they're infected. And the reason why is you might not know everything about that resident. Also, there are times that somebody can be infected with something and not show the signs and symptoms. So it's extremely important that you treat everybody as if they are infected. Standard precaution and transmitted-based precautions. These precautions are designed to reduce transmission of pathogens from both a recognized and an unrecognized source. The CNA and other staff members can never, ever be certain who may be carrying or is infected. Potential sources of infection. Again, all body fluid secretions except for sweat, regardless of whether it contains visible blood or not. Blood, mucous membranes, and non-intact skin. These are potential sources of infection. So wash your hands, wash your hands. That is the single most effective way to cut down or to hinder infection. You should always wash your hands after touching potential source of infection. This simply states that wash your hands before and after contact with a resident at any time your hands are soiled. Now, we should use personal protective equipment, also called PPE. It's a barrier equipment when touching potential sources of infection. Wear gloves and change them frequently after contact with any infected material. Proper use of gloves provides a protective barrier. Wear a mask and eye protection or face shields if there's a chance that body substances could splash or spray on you. Wear a fluid-resistant gown to protect your skin and your clothing, again, in case body substances could spray or splash on you. Handle residents' equipment with care, particularly when this equipment has had contact with potential sources of infection. It might be necessary that you use the PPE in order to clean the equipment. Handle linen with care. Assume that linen has touched potential sources of infection. Avoid contact with one's clothing. Handle so that the microorganisms are not transferred to other residents or to the environment. Use approved environmental control measures when cleaning up spills, disposing of trash, or cleaning the residence unit. Anything that's labeled biohazard waste and is in a red bag is usually something that has been contaminated. So handle that with care. You will also see in the facilities and even in the hospitals a red container with a biohazard sign on it. This is used for sharps. It's to prevent injuries from needles and other sharp devices. The nurse will dispose of needles in the sharp containers because it's puncture resistant. Also, if you're showering somebody and you're using a razor, that has a sharp on it, so it needs to be disposed of in the sharps container. Hand care is a part of standard infection control. Hands are our primary means of spreading diseases by direct contact. You really need to keep jewelry to a very minimum. Know the facility's policy. Your wedding rings and a watch. But remember, jewelry, watches, rings, they provide a place for microorganisms to live. Artificial nails, you need to know again the facility's policy on artificial nails. They are not recommended. You should also keep your nails clipped because that is a wonderful and nice place for microorganisms to grow in. Remember that around and under your nails is the location where those microorganisms are going to hide. Take good care of your skin. You need intact skin. That is your barrier. It's going to protect you. Hand washing is the most single measure in infection prevention and control. There's also a waterless cleaner. It's also effective, but it shouldn't substitute for washing your hands, especially if they are visibly soiled. So, washing your hands. Wash them when they're visibly soiled. You should always wash them after using the restroom, before eating, before resident contact, after resident contact. If you come in contact with any body fluids or excretions, and anytime you've touched something that's contaminated. you should use warm running water. When you go to wash your hands, keep your hands lower than your elbows. That means your elbows are going to be up and your hands are going to be down. Allow the water to flow towards your fingertips. Use firm rubbing motion to clean all surfaces of your wrist, hands, fingers, and nails. Liquid soap is usually provided in automatic dispensers. Wash your hands for adequately length of time, usually 15 to 30 seconds, or if you want to be like my granddaughter, sing your ABCs. Always avoid touching the sink with your clothing or your body. Some key points of washing your hands with the waterless cleaners. First, you should follow your facility's policy regarding the use of the waterless cleaners. If you do use a waterless cleaner, you should rub an adequate amount of cleaner onto all surfaces of your wrist, hands, and fingers. You should rub until it's completely dry, at least 15 seconds, or as in your facility policy states. If your hands are visibly soiled, you should use soap and water. Waterless hand cleaner is not to be used in food preparation areas. We will practice hand washing when we have skills. Now we're going to talk about key points of using gloves. I want you to know that with hand washing and gloves, these are things that you will be checked off on when you come into the skills fair. Gloves are to be used when hands have contact with blood, body fluids, broken skin, or mucous membranes. Gloves may be used to protect the CNA's hands if the skin is not intact. What I mean by that is your hands. If you have some open areas on your hands, you need to protect yourself from microorganisms getting in there. Gloves is the way you're going to want to do it, along with washing your hands. Hands should be washed after gloves are removed. Remove and discard soiled gloves immediately after completing your task. Remove gloves without contaminating your hands. Gloves are never to be reused. And gloves are made of different materials to protect individuals who have latex allergies. So those are some of the key points to using gloves. Now, there are different types of transmission-based precaution. There is contact precaution, droplet precaution, and airborne precaution. Transmitted-based precautions or isolation. That's what we call it most of the time, is isolation. These are infection control practices based on the way a particular disease is spread. They are used in addition to standard precaution for a resident who has been identified infected. But remember, always treat everybody as if they're infected. That's the best way to protect yourself. Types of transmitted-based precaution. Well, the nurse is going to identify the type of isolation or precaution that you need to use for a resident that is infected. The facility will have written descriptions of the isolation procedures. Remember that the needs of the resident does not change just because they're in isolation. The resident is still going to need personal care, just like they would if they were not in isolation. Their basic needs continue for safety, for security, for belonging, for caring, for their ADLs. Remember to care for the person as well as the disease. It's extremely important because they're going to be in the room and they're not going to be able to come out. And a lot of times, a lot of people don't like going in there because they don't want to have to put on all of that personal protective equipment. Also to remember is that the resident and the family need to be educated about why we're using these isolation precautions. It would be very scary to have somebody walk into a room with all of their personal protective equipment on and go, okay, what's going on here? So please make sure the resident and the family has been educated on why they are in isolation. Now, there are some times we have to use reverse or protective isolation. The purpose of reverse or protective isolation is to protect the resident. They might have a weakened immune system. Remember, they don't have enough of those Pac-Man to go and eat up those microorganisms or pathogens. So we have to put these people in reverse or protective isolation to keep them from getting pathogens from in the environment. Now, you really don't see this as much in long-term care facilities as you would in the hospital. A good example would be like a person that's had chemotherapy. When we give somebody chemotherapy drugs, we totally destroy all of the good cells and good Pac-Man in their body. And they are wiped out. They have nothing to fight off any infection. So therefore, they need protection from us or other people. So that would be reverse or protective isolation. Now, the last part we're going to talk about is if a CNA catches a break in a procedure. This is something that you can use if you see that there has been a break in the procedure. And we use these three words: stop, correct, and resume. A good example is you're in a room and you're providing incontinent care to a resident and you need some help. And so another CNA is coming in to help you. And maybe she washes her hands, but she doesn't put on her gloves. So you would say, stop, make sure your resident is safe, make sure the bed is in a low position that they can't roll over, and then you would go to the side, you would inform the CNA they forgot to put their gloves on, so they would therefore wash their hands again, put their gloves on, and then you would resume care for the resident. Now, while changing the linens on a resident's bed, the CNA places soiled linen on a bedside table. No. Don't place soiled linen on the bedside table. The correct action would be to, again, say stop. You would remove those linens. We don't use hampers anymore. We put everything in plastic bags. So we put that dirty linen in a plastic bag and then you tie it up. And then you would take off your dirty gloves and put on clean gloves and then clean the top of the table with a disinfectant. And that would be, then you would be able to complete the resident's care. So that is what you would do if there is a break in an infection control procedure. Well, congratulations. You have just completed Unit 4. There'll be a lot of things that we'll be practicing when you come in for your skills fair. There's a lot of other things that we're going to be talking about later on in a different unit about certain diseases. So I hope you learned a lot. See you next time.